Good afternoon and welcome everyone to today's complimentary webinar on sharpening your vaccine program, proven methods and tools to bring down costs, presented by IAMHP and VaxCare. Before we get started, I just want to run through some logistics. As you can see, IAMHP utilizes the GoToWebinar platform. Thus, a GoToWebinar control panel should have popped up on the right-hand side of your computer screen. This platform is how you will interact with today's webinar. At this point, you should all be able to hear me, but should you or your colleagues experience any audio issues, please direct your attention towards the audio tab or feel free to reach out to me directly via email. I will be putting my email in the chat. You can maneuver between your computer audio or your phone audio at any point of this webinar. Please note if you are going to use your computer audio, you may have to give the platform access. Next, please direct your attention towards the questions tab. Questions will be sent directly to me, and I will be answering a few of those as we move along throughout the presentation. However, I will also be collecting most of them for the question and answer segment at the end of the presentation. We'll do our best to address all questions, but appreciate your understanding if we do not get to your question today. And finally, please direct your attention to the chat tab. This is a fantastic tool for you to interact with other attendees or presenters. If you have any questions for me, please note I am coming up as IAMHP admin or IAMHP organizer. Now, depending on what version of GoToWebinar you have or your organization's firewalls, you might not be able to access this tab. If that is the case, feel free to reach out to me directly via email at judith@imhipteam.org with any questions. Again, I will also be putting my email in the chat. Now, let's get started with today's presentation. My name is Judith Ruiz Branch, and I'm the Director of External Affairs here at the Illinois Association of Medicaid Health Plans, also known as IAMHP. As a member organization for the Medicaid Managed Care Health Plans, IAMHP works with the Illinois state government, legislatures, advocacy groups, and Medicaid patients to invest in and provide high-quality health care focused on cost-effective, individualized care that helps the residents of Illinois live longer and healthier lives. Improving healthcare delivery systems is a never-ending job, and that is why we work with our members and industry partners to achieve better healthcare outcomes. As such, we are so excited to partner with one of our trusted partners, VaxCare, today for this very pertinent and timely webinar. At this time, I'd like to welcome Ralph Webker, Senior Medical Director at VaxCare, who will be leading us in today's discussion on vaccine programs. Welcome, Ralph.
Great, thank you, Judith. And thanks everybody for taking time out of your lunch hour. Wanted to take about 30, maybe 35 minutes, leave some time for questions, and then definitely finish up before 1 o'clock. And there's obviously been a ton of emphasis on the COVID vaccine, and just to be 100% clear, I am 100% for the COVID vaccine. I definitely think it's our pathway out. I want to focus more today on some of the logistics of getting more vaccines into primary care offices. To kind of boil the presentation down into kind of one or two words, I think most offices, the mistake that they make from a vaccine perspective is they're not measuring their vaccine program. And if you don't measure something, you don't know how well you're doing. And if you don't know how well you're doing, you can't evolve. So what I'd like to do today is do an overview, talk about some of the most common mistakes, and then what are some suggestions. The first, some disclosures. So I am 100% employed by VaxCare. This is not a discussion today to talk about VaxCare. This is to talk about supply chain of vaccines in general, but we do work with 3,000 practices in 25 states. We work with a number of practices in Illinois and Missouri, working with Medicaid plans, Medicare plans, commercial plans, and then also integrate with 12 of the 15 largest EHRs. So again, if you'd like more information on VaxCare, my information is available at the end, but this is the last that you'll hear about VaxCare. At the end of the day, our goal, our objective is, we believe that sharing best practices, particularly around supply chain, if more practices give vaccines, then the immunization rates are going to go up. Study after study after study shows that if you want a patient, especially the ones that are on the fence, to get a vaccine of any kind, flu, COVID, DPT, polio, the best way is have them see their provider, whether that's physician, nurse practitioner, PA, and have them have an honest, open discussion about the vaccine. And then after the patient agrees to that, the nurse comes in a minute later and administers the vaccine. So anything that we can do to get the vaccines boosted in especially primary care offices, but any physician offices in general, is going to have really, really favorable effects. And I think what's happened is, for a variety of different reasons, physician offices have taken their eye off the ball from a vaccine program perspective. So we'll talk about some of the challenges today and some of the issues that make this supply chain around vaccines a little bit more difficult. And then we'll talk about some of the ways that you can make it improve, and you can lower your costs, lower time, or decrease the amount of time spent, and then cut down the errors. And then, probably most important, at the end, I want to give you at least the framework for a scorecard or a dashboard that you can follow at your office and look and say, okay, this is how we're doing right now. Here's the particular area that we're falling down, and what's the area that we can make an improvement on. And then obviously at the end, you can feel free to either put questions in the chat, or we can take live questions as well. So, big picture macro perspective, what are some of the challenges to running an efficient and profitable vaccine program? And if I had to boil it all down to two items, if you look back 20, 30, 40 years ago, the good news and the bad news is we're no longer in a situation where we're giving a tetanus and a flu. For a pediatric office, or whether you're talking about adult vaccines, we're now talking about managing multiple newer vaccines, and because they're multiple, that increases the complexity, and because they're newer, they tend to be more expensive. So because they're more expensive, there's more money on the line. If you're not running it well, it can definitely increase the cost, and there is bigger ramifications for any mistakes. Most of the offices that I've been in and worked with, is the vaccines are their second largest cost, only to labor. And probably don't need to talk to anybody on this call about how difficult labor is right now, but thinking through, hey, here's here's this huge cost center, are we dedicating as many resources to it as we potentially could? The managed care organizations, this is not a beat up on managed care or anything. At the end of the day, the managed care is probably the only entity within the healthcare ecosystem that is trying to hold down costs. But there are processing, and so how quickly do you receive payment? How is that payment processed? If you're talking about having $10, $20, $30, $50,000 worth of vaccine in your fridge, a day or two or a week or two in terms of that payment process can really make a really make a big difference on your bottom line and your financials. It's a fragile product. It has to be refrigerated. Some of it has to be frozen. It has to be managed at different temperatures. It can go bad, whether the vaccine needs to be reconstituted or come in pre-filled syringes. If you're not paying attention to that, that can really create some issues. And again, it's not one size fits all. So there's almost multiple supply chain processes that a practice needs to think through. The higher deductibles, there's definitely been increased cost sharing by employers, by managed care, and I think it's get patients more engaged. As a general rule of thumb, the vaccines are universally covered with limited out-of-pocket, but unfortunately, we are seeing a little bit of trickling around more patient responsibility for the vaccines. And then finally, the vaccine hesitancy and conspiracy theory. I think one of the true tragedies that's going to evolve from the entire pandemic and all of the fighting that's going on about the COVID vaccine is, I hope that I'm wrong. I haven't heard any data or seen any data yet, but my guess is there's going to be some spillover effect to some of the other vaccines about, hey, are there transmitters, or hey, how does that affect sterility and things like that. But that's probably something that we're not going to know for a couple of years. And if you just think about it from purely a clinician's workflow time, almost guaranteed you're managing more questions about vaccines on a daily basis, and 1 to 2 minutes more per patient really adds up into real time. And we'll talk at the end about joining GPOs in order to get the best financing. There are definitely some tricks and some considerations in order to make sure that you're managing that the best that you can. But this is no longer a system or process where you can just tuck it into the corner and it's going to run itself. There's way too many variables and there's some complexities, but it can be 100% done. It can be done well, and it can be done profitably, and there's no reason that it shouldn't be able to be that way. From a schematic and from a visual perspective, I think it's helpful for me to think about the supply chain and where do the bottlenecks, where do the issues occur in a particular office. And one of the particular problems that we've seen is whether you're talking about an EHR, whether you're talking about billing software, whether you're talking about scheduling software, there's no system, there's no software that manages vaccines from beginning to end, meaning, okay, I'm going to put 10 DPTs into this system, and I need to know where are those 10 DPTs anytime during the life cycle. So the kind of the summary piece is thinking about the financial loss. The big piece here is, are there doses that didn't get billed, didn't get documented, the patient changed their mind, we forgot about, we constituted the vial or we got it ready and it didn't get used for whatever reason, and then understanding how much waste and leakage do we have, and how does that translate into reimbursement. You should definitely pay attention to every single vaccine. You should really pay attention to the newer, more expensive vaccines, particularly thinking about Prevnar as an example. One Prevnar is $200. As a box of 10 with roughly $20 profit on each one. If you just lose one dose or don't bill or don't document or whatever that is, one vaccine out of that box of 10, you just wiped out the profitability. And so understanding, hey, how are we doing? Nobody's perfect, but having a true assessment and saying where is that loss and leakage happening. The manual work that the nurses are doing, if there's any opportunity to decrease that, the nurses spend a tremendous amount of time writing lot numbers. Where did they, what area did they receive the vaccine? And then finally thinking about what number of is your error rate, meaning the patient received the wrong vaccine, or and the nationwide average is 1% to 2%. Where are you sitting? It would be very unlikely that you're at 0, but understanding that, and again saying, if you don't understand where you are, then you're not going to be able to make improvements. So a couple of the sub-segment areas of where some of the issues are a little bit more common is thinking about charting, thinking about documentation. How quickly can we get the information in the EHR, or are you on a paper registry? Most states have a requirement to report that out to the state registry, and most of the EHRs or the billing systems will produce a process where you can do that. And then if you're evaluating a new EHR system, hey, where is it gonna work from a vaccine perspective, and will it be able to be connected to my billing software, be connected to my my scheduling system. This is really important for the folks from managed care on the phone. Any ability from a physician provider perspective to get that information transferred out has big impact on quality scores, some of the HEDIS metrics and things like that. So getting those reported off and increasing that transparency and communication is really, really important. There's the billing components and understanding how are we, and I think that this is mostly a microcosm for most offices from their revenue cycle perspective in terms of, hey, what payers are we in network? What payers are we out of network? What's the reimbursement rate? Are we submitting correct claims for the payers? And then probably the number one mistake that we see, especially with some of the newer multi-antigen vaccines, is depending on if you're giving single, dual, triple, or more than that, there's different antigen charge codes for the administration, and make sure that you are using the correct administration fee code, because there's higher reimbursements for the multiple antigens versus the single or solo. So that's just purely getting it right can ensure that you're getting accurate and appropriate reimbursement. Thinking about ACOs, profit sharing, tracking the rates, from a payer perspective, they're probably going to be very interested in understanding, hey, how are we doing on the different vaccine rates from under 15 months of age to flu for pregnant women, some of the other key quality metrics as well. And then make sure you're staying up to date on some of the key updates. Just last week, CMS approved an increase in the administration fee for flu and pneumo for 2022 from between $16 and $18 per dose to $30 per dose. And then the COVID vaccine continues to be one of the highest reimbursed from an administration perspective at $40. So staying up to date on some of those finance pieces is really important, because it's more than just the reimbursement of the vaccine, it's the administration reimbursement as well. Then finally, collections. Hopefully, you already have a good collections process and working with the payer, getting claims submitted, and hopefully the vaccines would just be a subsegment of that, and that would work well. The only piece here, other than some of the more common revenue cycle suggestions, what's my accounts receivable, what's the time to payment, some of the obvious ones that hopefully everybody's tracking, is understanding the vaccine specific denial codes. If this is not a covered service, what does that mean exactly? Most payers do provide reimbursement for the vaccines. I've never spoken to a payer medical director or chief medical officer who was not a big believer in vaccines, didn't think that that was something that was very worthwhile. So sometimes the denial reasons can be a little bit ambiguous, and dig in and understand maybe it's just maybe it's a documentation issue, maybe it's an information issue, but clearing up why did we get those denials. Just want to pay one note from a tactical and day-to-day workflow perspective. This is something that I think most offices don't have very much control over, but if you think about the logistics of how much time are you or your nurses or your staff spending coordinating around the office, as much as possible, if you can distribute the vaccines from a central location rather than one corner definitely helps you to bump up and get a bunch of steps, but it's not good from a workflow perspective. If you're spending 30 seconds or 1 minute per patient just on walking, or because the vaccine storage area isn't in a convenient location, again, 30, 40 minutes every day, depending on how many patients you see. So again, this is something really, really hard to change for most offices, but on the same token, don't blow it off, because it can have a big impact on workflow. So let's finish up and spend the last 10, 12 minutes and talk about a dashboard, metrics. And I love the quote from Peter Drucker, who is a famous economist, and said, you know, what gets measured gets managed. And meaning, if you're not paying attention to this, you're not gonna get any better. And I would say the number one error that I've seen in most of the offices is either this is a side job for somebody that already has too many jobs, or this is something that is way more complicated and complex than the person that is responsible for doing it. So the rough outline, and there's no one size fits all in terms of how this is put together, but I try to think about the vaccine supply chain in three pieces. There's the clinical component, there's the workflow management, and then finally there's the financial. And most offices have a pretty good handle on the financial, but maybe they're not paying as formal or as close of attention to the clinical and workflow management. So first of all, from a clinical perspective, I think that this is going through most physicians' minds, most nurse practitioners' minds, but if it doesn't get communicated, hey, here's what we need to do, that it can get missed. And just some obvious things. First of all, are you up to date on the vaccines that you're administering? I would hope most pediatricians, most OB groups, family medicine are administering HPV, for example, but there's also been a number of updates during the pandemic to the vaccine schedule, And I've seen that a lot of physician groups are not as familiar with some of those changes. HPV got recommended, they changed the recommendation from 27, from 9 to 10 to 27 to you should really clinically evaluate your patient, potentially up to 45 years old. A lot of practices are not aware of that change. There were also some changes on HIB and the dosing that was required after 15 months of age. And then obviously the CDC has made a lot of recommendations on how do you best catch up patients given the number of missed visits, missed vaccines during the pandemic. So thinking through, hey, are we up to date? And the CDC, for all the grief that they've taken, they've got some pretty nice charts to say, okay, here's the ranges, and you can kind of come up with your own recommended schedule. Think about your individual community. Are there measles outbreaks? If it seems like every other year there's a measles outbreak in Minneapolis, and it's probably worth pushing the MMR a little bit harder for those particular patient populations because there are outbreaks. So where do things sit in Chicago versus Springfield versus Southern Illinois? And then the flu vaccine. Hey, we're kind of just finishing up flu vaccine season. And the good news is, which I was not aware of, but the CDC's reported over the past 10 years, there's been an average of about a 5 to 10% increase in flu vaccine administration throughout the country. Where do you sit? How hard do you push it? That's really important. And what's going to be your process to catch patients up that are behind? I think one of the most tried and true processes that I did when I was in practice is just establish the baseline that the patients are going to get these vaccines, and it starts at the front desk. The front desk is, hey, you're here for a well check, or you're here for this. You're also behind, or we're also going to give you these vaccines today. The nurse checks in and says, hey, these are the vaccines that you're going to be receiving today. So it's no longer a big discussion like this is where we are, and here's the vaccines that you're going to be receiving today. For the physicians, nurse practitioners, one of the areas, there's a big opportunity, and there's been a big push, at least by the American Academy of Pediatrics, for quote unquote quality improvement assessments in the office setting. And you can actually, if you do one of these assessments, you can actually use it for your maintenance of certification. So as you're thinking through, hey, here's my clinical workflow, here's the opportunities. If you are due up for your board's recertification, it'll be a great opportunity to demonstrate what you did for that. So the second piece is the workflow management. And what I mean by that is this is all the boring stuff, right? Like, how often are we counting inventory? Our experience from a nationwide survey that we did is 54% of offices count on a weekly basis, 78% of offices count on a monthly basis. In an ideal perfect world, you're going to be counting every single hour so that you would know exactly where and when the doses get lost, but that's not feasible. I think monthly is way too infrequent to make some process improvements. So thinking through, how big is our office? How many vaccines do we do? What is that? I feel for most offices that a weekly count would be best practice. How long does it take? Who's doing it? The office manager, the medical assistant, and are we able to track where the losses are happening and take action. What can we do to correct that? What's the number of vaccines that need to be returned? There was a change by one of the flu manufacturers this year in that they put a limit on the number of flu that could be returned from 25% down to 10%. So you better be really careful when you're ordering flu vaccine, because if you order too much, you're not going to be able to return as much as in prior years. On the same token, you definitely don't want to run out as well. You don't want to run out from a clinical perspective. Patients miss out on the flu vaccine, but it's also missing out on revenue and financial upside as well. Some of the other things to think about, what were the number of doses that were given? What were the number of doses that were billed? Did we collect? Do those numbers all those numbers match up? And where are we from a waste loss? Compare, hey, here's the inventory that we would expect from the reporting versus here's what the actual inventory is. Hopefully that's just 1 or 2 percentage points off, but if it's large, that's going to be an obviously big area, because if you lose or misplace one dose, especially those really expensive vaccines, that can wipe out a lot of profitability. And then finally, if you have multiple offices, is there consistency between those offices? The third piece, which in my experience, most folks do a fairly good job, is understanding the financials. If you do lose a vaccine, how much do you lose? How many, and a good mindset to think about is how many doses do you need to give in order to make up that particular profit or make up the loss on that particular vaccine. And thinking about from a profitability perspective and different purchase options, the physician buying groups, the GPOs, and then think about some of the logistics. Obviously, there's tiers. The more you purchase frequently, the lower the price that you get, but make sure that you're not running into what I would call the Sam's phenomenon, when if you're 20 years old and you go to Sam's and you have to buy 2 gallons of milk and you drink a half a gallon of milk a week, you just wasted that. And so thinking about how much do we order at a time, how much do we consume a month, and what would be kind of that ideal, and then balancing off the cost, balancing off the reimbursement. And a good way to think about it is the administration reimbursement plus the vaccine reimbursement should be greater than your vaccine cost and your overhead. And you could drive yourself crazy trying to drill down into overhead, but in essence, how much material, how much nurse time do they spend on administering one vaccine? And then opportunity cost, who's managing this? In an ideal perfect world, it should probably be the physician, but in most practices, that's just not practical. So is it the office manager? Is it a nurse's side job? And again, the more focus that you pay attention to it, probably the better results that you're going to get in terms of catching errors, checking for mistakes, versus if you're ignoring it and not paying attention to it, you most likely have more loss than leakage. There's an inventory tracker as well as kind of some other rough models, and I'd be more than happy to send those out to you. They're pretty basic. Hey, how many units do we have in stock? How many did we receive? How many did we bill for? How much was in inventory? Do those numbers match up? If not, why not? And I'm happy to send that to you. My contact information is at the end. You can feel free to reach out to me, and I'll get that sent over to you. Finally, just a case study that we did a few months ago. We were evaluating an office, and they said, how are we doing from a vaccine perspective? And so we went through and basically looked at, I think it was slide number 4, and said, okay, let's drill down and understand how much time opportunity savings is there per nurse, how much inventory is being lost, and again, not billed, not documented, not collected, patients changing their mind, expired, whatever, and then how much time is a practice spending on daily oversight of the process. And between $400,000 and $600,000. Now, this was a large pediatric practice, but the reason that I bring this up is for many practices, this is a invisible cost, and they wouldn't be able to drill and say, this is how much money that we have opportunity for. And so unless you dig into this, there can be some real dollars, and hopefully with the world getting ready to open back up, we'll get vaccine rates to go back up, and there's some revenue opportunity for the practices as well. So thanks for your attention. Judith, I'll turn things back over to you, and if there's any questions, I'm happy to answer any questions as well.
Great. I just want to thank you so much, Ralph, for that pertinent information. I'm sure it was very helpful to everyone who is on today's webinar, and it's very, very needed during this time. So I just want to take a second to just do a call out for any questions that you guys might have. You can feel free to put them in the chat now or unmute yourself and just ask them.
I probably didn't talk enough about COVID, but I felt like everybody else is talking about COVID.
Yeah. Okay, well, we do have 2. So okay. Just the first one is just asking if you can compare and contrast before and after the pandemic, and the impact the pandemic has had on vaccine rates, and any suggestions when it comes to that.
Yeah, I think if we had to think about the pandemic, it's going to end up hurting vaccine rates overall. And I think part of the issue is going to be labor. Private practices and physician offices are not exempt from any other area of the economy where there's this shortage of labor, and something has to give, and frequently maybe it's not giving flu vaccines, maybe it's not giving a shingles vaccine to patients over 50. And then I think I briefly touched on this, is I really worry about the spillover of patient resistance. And because docs are so stretched and the labor is so tight right now, a lot of folks, they're not taking the time to answer and address the patient's concerns for the vaccine, because there's 20 other things going on. And so because there's less people to give the vaccine, because time is tighter, because there's more questions that are being raised, I can't see the pandemic doing anything but bad things for overall vaccination rates, unfortunately.
Okay, that's helpful to know. Thank you. And then the last one is, what's the most important takeaway that you want us to walk away with?
I think the most important takeaway is if you're not measuring your vaccine program, and it doesn't even need to be super sophisticated, but if you're not measuring it in some way, shape, or form, most likely you're doing it very poorly. So start with some type of measurement. how many ins, how many outs, and you can get as sophisticated or as crazy as you want. But this isn't something that's just going to run itself. And for most offices, you've really got a lot of money on the table to ignore it and not pay close attention to it. So, as Peter Drucker said, if you're not measuring it, you're not going to be able to manage it and improve upon it.
Yeah, I really love that quote when you used it earlier. It can apply in so many different areas, but especially this one. So,
Yeah.
well, thank you so much. This has been really, really great, and we really, really appreciate your time. Um, just want to put it out there. If you are interested in becoming a trusted partner like VaxCare, I encourage you to reach out to me after today's presentation. Again, I put my email in the chat for your access. Or you can visit us at our website at IAMHP.net. That's IAMHP.net. As part of being a trusted partner, you actually have the opportunity to attend all of these webinars complimentary, among other benefits. So if you want any more information about IAMHP, the offerings that we have, and more information on webinars like these, feel free to visit our website, IAMHP.net, and also follow us on Facebook, LinkedIn, and Twitter. And if there is nothing else, then you guys can have about 14 minutes left of your day, and we will be sending out a follow-up email with Ralph's information, my information, and any handouts or resources that VaxCare would like to provide. So without further ado, thank you for joining us, and enjoy the rest of your afternoon.
Awesome. Thank you, Judith. Thanks, everybody. Bye-bye.